Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you for joining us. You may not think of cancer as a lifelong disease, but that's the case for many people that are suffering with certain slow-growing forms of cancer. Now, here to share more about some chronic blood cancers and some resources available is medical oncologist Dr. Alexey Danilov. Welcome to the program, Doctor.
Thank you so much. Thank you for having me here. There is quite a few blood cancers there which are not common, but blood cancer in and of itself is actually very common. About 1 million people live with a diagnosis of blood cancer in the United States, and someone gets diagnosed about every 3 minutes. And unfortunately, we lose a life to a blood cancer or its complications every 9 to 10 minutes or so. So, in fact, blood cancers are not that rare, and while under that umbrella there are some more rare subtypes, in general, it is a fairly common diagnosis.
Well, what's an example of one of these chronic blood cancers?
So chronic, or what we call them indolent, slow-growing blood cancers would be something like follicular lymphoma, which is actually fairly common. About close to 20,000 people get diagnosed every year. Another example is chronic lymphocytic leukemia. Even though it has the word leukemia in the name, it is actually a non-Hodgkin lymphoma. That's another 20,000 people. And so what makes them different from acute leukemias or aggressive lymphomas is that we do not necessarily start therapy at the time of diagnosis for those indolent, slow-growing cancers such as follicular lymphoma. So 4, 5, 6 years may pass often before we initiate treatment for follicular lymphoma. And treatment is then based on emergence of symptoms or certain disease complications. And this is not necessarily an ominous sign. It's not because we do not have good treatment for those conditions. It's because because actually follicular lymphoma can stay under good control without our interference. And we use what we call a watch and wait approach for follicular lymphoma, CLL, some other lymphomas as well.
So a watch and wait approach. Once you've watched, what are the treatment options?
So treatment options are quite many at this point, and they are constantly improving, I should say. Over the past 20 years, there's been a significant improvement in outcomes in lymphoma, including follicular lymphoma. And part of that improvement came from development of new drugs. So we use chemotherapy. We often use drugs such as bendamustine or cyclophosphamide. We use antibody therapy, immunotherapy. Examples there would be a benitumab or Gazyva, which was approved in the past year for treatment of some patients with follicular lymphoma. Rituximab, an antibody drug which we have used for over a decade. And those drugs certainly are improving outcomes in this disease. Well, none of them are 100% safe, so those drugs do have their own side effects and can cause certain complications. However, in this day and age, we are able to choose the right therapy for patients based on their disease manifestations and based on the patient needs. So there is not necessarily a one-size-fits-all approach, and patients should really talk to their physician about what's right for them. But we are becoming much better at choosing the right therapy from the arsenal that we have for everybody.
As common as you say follicular lymphoma is, who is affected more?
Well, so generally follicular lymphoma, chronic lymphocytic leukemia are more common among folks in their 60s and 70s. So older people are more likely to develop those conditions than younger people. Although I do have a few younger patients in their 30s and 40s with diagnosis of follicular lymphoma.
Treatment options, do they differ greatly based on a person's age, or, as you say, normally they get them up in years, but you get those special ones that get them earlier in life? Are the treatment options identical?
Yes. The initial approach may be similar. we typically think of follicular lymphoma as incurable disease. For younger patients, the options this becomes more complicated question because if someone gets diagnosed in their early 30s, mid-30s, we are looking at a general life expectancy of 50 years, which we have to support them through. So this is a group of patients where we begin to think about cellular therapy, stem cell transplant. So that is a fairly complicated topic. It's certainly not for everybody and not for many older, not a good option for many older patients with follicular lymphoma. But this is right now the only curative approach that we have.
Is it difficult to find some of these treatment options based on the level of your disease?
In general, most of those treatments are effective in follicular lymphoma. We are usually able to choose the right therapy, a combination of chemo, immunotherapy, or something else. There are certainly a few options out there which we are able to choose from. So for most patients, we are able to choose the right therapy.
Where can we go online and learn some more about follicular lymphoma and some of these other slow-moving forms of blood cancer?
Lymphoma Research Foundation runs a great website, lymphoma.org, which they have recently redesigned. It's very well organized, has a lot of good vetted information on it. Leukemia and Lymphoma Society is another organization that funds a lot of exciting research in the field of lymphoma. So I would recommend those two highly.
Great. Well, I thank you for coming in and sharing with us today.
Thank you very much.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Dr. Alexey Danilov. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to our podcast on iTunes, listen in and download at SoundCloud, and visit our affiliates page at hpr.fm.